Well, good afternoon, everyone. I'm Keel, the president of Augusta University, and it's a pleasure to be with you here today for this town hall. And I hope that you will find this informative, and we'll try our very best to give you the latest and greatest information that we have. I was just going to say, we're getting ready to start the fall semester, but the fall semester has already started. We started moving in our students here on Monday, this past Monday, and it's always exciting when you get new students on campus, and we're really, really pleased to be able to be here at this time. So thank you very much for joining me today. We are back to school in the fall 2021, and there have been some developments in terms of new policies, procedures, et cetera, and some old ones that we want to revisit. And the bottom line here is, I think this slide really summarizes it. We want to keep calm, but it's going to be business as usual. Our classrooms and residence halls are at their full capacity. We are in full in-person course modalities, and everyone is expected to be back at their regular office locations pre-COVID, and that is where we are today. But there are some caveats associated with this, and what I hope to be able to do is to sort of describe what those caveats are and let you know some of the latest things, as I said, that we know about, especially coming from the university system. Bottom line is, we're not out of the woods yet, and we're not going to be out of the woods for a while. I think that's fair to say. Unless you just have been in a cave for the last 2 or 3 weeks, you know full well that the Delta variant has become very prominent. The COVID cases are increasing. We know that, increasing here, increasing across this country. And we're dealing with that appropriately. Before I go any further, let me just stop and remind us all how fortunate we are at this institution to be part of the greater enterprise that contains the Augusta University Health System, the Medical College of Georgia, and all of our allied health, nursing, dentistry, and research programs here too. And I rely on that expertise. We rely on it every single day. And it is what has gotten us through the pandemic so far, and it will be what will get us through the woods over the next several months as we move ahead. I also don't want to pass up this opportunity to say thank you for the frontline workers who just a short distance over here are, even as we speak, taking care of not only COVID patients, but taking care of the sick, and they do it 24 hours a day, 7 days a week. They are tired of this, and I know that, and I want to personally thank every single one of them for what they do, because we're not out of the woods yet. So thank you very much. So let me give you some of the latest updates from the University System of Georgia, and let me start off by saying, as I mentioned, the health system has its own policies and procedures with regards to how we deal with COVID-19 or any other disease for that matter, and they don't always equal that of Augusta University. The criteria for wearing masks, for social distancing, for a whole variety of things is currently different and may be different as we move forward from what we do on the university side of the house. So please be aware of this, especially if you have colleagues that work in the hospital and you hear what they're required to do. It may not match what we're required to do on the university side of the house. And so please bear with us and keep that in mind. And the same thing also applies for our clinics in the Dental College of Georgia and any other clinical space that we have. So be mindful when you walk into those spaces what the current requirements are. So what about mask and face coverings and socially distancing criteria? Well, what the guidelines are right now, as of today, and will continue and for the foreseeable future, is that masks and face coverings are not required for campus, in buildings or otherwise, and they're not required regardless of vaccination status. However, we are strongly encouraging everyone, including vaccinated individuals, to wear a mask or face covering while inside campus facilities. There are no social distancing requirements. Institutions are going to return to campus in the fall with no social distancing measurements, and although unvaccinated individuals are still strongly encouraged to continue to socially distance from others when possible. So masks and face coverings are not required in any facility on our campus, the educational facilities on our campus, although we do strongly recommend that everyone wear a mask. And I think that's the bottom line we have to all embrace and help everybody understand moving forward. We are a university and a system that cares deeply about each other. We are all in this together. I'm asking you to please work with me. It's not about the politics here. It doesn't matter what I think about the politics. And to be honest, it really doesn't matter what you think about the politics. It doesn't matter whether I want to wear a mask or not wear a mask. We are in this together, and it is not about the mask versus the unmasked. It certainly isn't about us and them, on which side of that equation you find yourself on. We're going to have to all work together to get through this. We've been through an awful lot, which gives me great confidence that we'll be able to get through this. So please, let's live up to the values that we publicly say we hold so dearly at this institution. Let's support each other. Let's respect each other. And if we can do that, we can get through this. All right, what about teleworking? Employees with current COVID-19 related telework assignments should have already been back to their pre-COVID work arrangements. The COVID-related teleworking arrangements have ended and ended back in June. In no circumstances should telework be considered an employee right or entitlement. Department heads and their designees now, in the past, and always will have the authority to establish teleworking arrangements. But this needs to be the exception rather than the rule. That should be exception, not exception. I see that. So it should be the exception rather than the rule. All teleworking requests and designations are based upon management discretion in accordance with determination of what's in the best interest of the institution and the employees and the students and patients that we serve. Yes, we will encourage teleworking when it works and when it makes sense, but it is not to be used because of COVID. It is only to be used because of increases in efficiency. And even then, I ask our managers to really consider this very, very carefully. There are processes that you can go through to request teleworking arrangements when it's necessary. What about accommodations, both normal accommodations and COVID accommodations? All COVID-related alternate work arrangements or accommodations ended on June 30th this year. All employees expected to have already returned to their previous work arrangements at this time. COVID-19 related accommodations are no longer allowed under any circumstances, and lack of vaccination is not grounds for a request for an accommodation. That is the guidance and the rules in the University System of Georgia, and we, being one of 26 campuses, will follow those guidance and rules. Please check with HR Student Services for any ADA or academic and learning accommodations. Obviously, clearly, there are a lot of our students and faculty that require accommodations, and we're going to honor those, obviously, but not because of COVID. Alternate educational arrangements for students also ended in June, and the students are expected to return to their traditional educational arrangements as well. And again, lack of vaccination is not grounds for requests for an accommodation for students either. In terms of student life, institutions are expected to resume traditional student activities beginning in this fall, and we're going to encourage mask wearing, but we want to also provide the type of student life that our students demand and that we want to provide. What about instruction modality? We are expecting normal in-person classroom instruction this fall. Normal in-person classroom instruction this fall. The only online or hybrid courses that should be offered would be those that would have ordinarily been offered anyway. Now, obviously, we have some online courses, and they will continue. But the courses that we used in a hybrid fashion last semester because of COVID, that's no longer allowed. Individual instructors do not have the authority to alter their overall modality of their instruction. There's very rare exception to this, and I'll get to that in a few minutes, and any exception must involve the dean or the provost. So we're expected to provide full in-person classroom instruction, and that's what we're going to do starting this fall. What about vaccinations? We'll spend a little bit of time on vaccinations, but most importantly right now, institutions are not responsible for assessing current COVID-19 vaccination rates and are not responsible for tracking vaccinations. Unvaccinated individuals are still strongly encouraged to get a vaccine. And I'm going to kind of fly past that right now because I'm going to spend a little time begging you to get vaccinated in a few minutes. Also, unvaccinated individuals are also encouraged to continue wearing a face covering and to continue socially distancing from others whenever possible. Adherence to this guideline is the honor system. We're not allowed to, and we're not going to ask a person, are you vaccinated or not? We're not going to segregate classrooms. And all the vaccinated folks on this side, and all the unvaccinated folks on this side. That's not going to occur. None of us have the authority to request that information, with exception, and I'll get to that in a minute. Clinical students and study abroad students may be required to be vaccinated by their third-party training locations. I see some folks in the audience here today that have students that are going to be doing clinical rotations. And if the hospital or clinic or doctor's office or location that our student is going to be doing a rotation in requires vaccination, then we can require that student to be vaccinated to participate in that activity. I see Dr. Kelleher in the audience. The same with study abroad. If we do study abroad and the location where students are going to go for study abroad requires vaccinations, we can require it. Our student athletes, the system office has told us that we are to abide by conference guidelines. And our student athletes, if they are required to be vaccinated in order to compete by their athletic conference, then we're allowed to require those students to be vaccinated as well. So we're going to follow those mandates. What if you've been sick or exposed? And I'll have to tell you that we're still in the process of determining what some of those guidelines are going to be. So hang with us on this. There's the vaccinated and unvaccinated, and the requirements are different for isolation and quarantining. And when I say vaccinated, I mean fully vaccinated, okay? And that is defined as an individual who has had both shots of the Moderna or the Pfizer vaccine and is 2 weeks beyond the second shot, or is 2 weeks beyond the single Johnson & Johnson vaccination, okay? So a fully vaccinated person is 2 weeks beyond the last shot that they've had. If a fully vaccinated individual comes in close contact with someone who has COVID-19 and they currently have no symptoms, quarantine is not required. You can still go to work, still go to class. It is recommended, but it's not required. It's recommended that the individual wear a mask for 14 days or until they test negative for COVID-19. And there is recommended that they get COVID-19 tested 3 to 5 days after exposure. So if you are vaccinated and you are contacted from someone who says you are coming close contact with someone who has COVID-19, you should start wearing a mask for 14 days, get tested in 3 to 5 days. If you're negative, you no longer have to wear a mask, but you do not have to quarantine. I think everybody, hopefully by now, understands the difference between quarantining and isolating. Now, if you're experiencing COVID-19 symptoms, you should isolate from others, get tested, and be clinically evaluated. That doesn't tell you a whole lot, does it? And I know it doesn't, and we're working on those guidelines even as we speak, try to get clarification on exactly what that means. So bear with us, stay tuned. We'll get the information to you just as quick as we can on that. For the unvaccinated, you essentially follow normal established protocols for isolation, quarantine, and testing, and you can get those protocols are on our website. So please make sure that you understand that. Employees who must isolate or quarantine from a COVID-19 illness or exposure can telework with the approval of the supervisor, whether you're vaccinated or not. The nature of the position, of course, is going to influence whether employees are able to telework, and not every single one of our employees, just because of the type of work that they do, have the capability to telework. Department chairs will have to make arrangements for class coverage when faculty are unable to teach during an illness. But the course modality can be altered for the period of time that the faculty member is staying home, and that is the only exception to the you cannot alter modality in teaching rule. If you have if people are confused about that, please contact somebody in academic affairs, and we'll make sure you get information that you need. If a faculty member becomes sick, has to isolate at home, that's when the faculty member, with the guidance from the department chair and dean, provost, can change the modality of the course while they're at home recovering. That's the only time. When telework is not possible, employees who must isolate or quarantine due to COVID-19 are required to use accumulated leave to be away from work, it's either sick leave or annual leave. Now, employees can continue to use COVID-19 vaccine leave in order to receive the vaccine or if they experience side effects from the vaccine. We're trying to encourage folks to get vaccinated. So if one employee says, I need to take off work to go get vaccinated, absolutely, you bet. Let them do that, and they won't be required to take their own personal leave to do so. Or if they have side effects from a vaccination and need to stay home for a day or two, and that's rare, but it does happen, then they can also use COVID-19 leave and not their own personal leave for that situation. Contact tracing. At this institution, student health and human resources, student health for the students, that's Dr. Dollinger and student health and his folks, and Susan Norton and HR and her folks have the responsibility for doing contact tracing. They are the only individuals who have the ability to ask a person about their vaccination status. And the reason that they need to ask the person is to provide that person with the proper advice, depending on their quarantine and isolation criteria, because they're different between a person who's vaccinated or not. They can ask for proof of vaccination, but it's not required. And then they can provide the proper advice. So please help your managers understand if someone in your office has a close contact, they cannot be the one to ask them if they're vaccinated or not. Refer them to HR for employees. Refer them to student health for students. Now, on the health system side, that's all handled by employee health. And they're the ones who would manage that aspect for our health system employees. Individual faculty and staff, managers and supervisors are not allowed to inquire about vaccination status, nor can they require mask wearing. You've already heard that. There could be no discrimination whatsoever against anyone for not wearing a mask or based on the vaccination status. I think I've beat that up enough, but it's real critical that everyone understand that that's where we are today, and that's what we're going to have to do. I don't know how else to say this, but if it would make a difference, I'd get on my knees right now and beg, please get vaccinated. Please, please get vaccinated. Please get vaccinated. I don't know how else to say it than that. That is the only way we're going to get beyond COVID-19. And there is a heck of a lot of misinformation out there about the vaccine. I'm going to be mounting a social media campaign aimed at our students primarily, try to help them understand what some of the myths are out there. And I just want to share some of those myths with you. We have experts in the audience, and so if I misspeak, I'm going to ask them to come up here and correct me. But I think I've got the answers for these particular myths. The first one myth is, I've already had COVID-19, so I must already have enough antibodies and don't need the vaccine. That's not correct. The immune response that you get from the vaccine is better. The natural infection is actually more predictable. Although most, if not all, individuals who have had COVID-19 in the past do develop antibodies, that's the body's natural way of fighting an infection, it is variable between individuals depending on the circumstances of your particular disease. The vaccine is more consistent, it's more dependable, and if you've had COVID-19, you should get vaccinated. Now, if you've had COVID-19 recently, you need to make sure that your healthcare provider knows that so they can guide you on when you should get your COVID-19 vaccination shot. But just because you've had it doesn't mean that you shouldn't get it. You should still get vaccinated. I can't afford the vaccine because I don't have insurance. That's also wrong. The COVID vaccine is completely free of charge. You can find an appointment today at augustahealth.org/vaccine. We will get you a vaccination shot if you want one. It's very easy to do. Number 3, the vaccine came out too quickly, so it can't be safe. And this is probably the one I hear the most. And I do understand that because we have heard about how long it takes anything to get through the FDA. And then you've heard about this emergency use authorization. It sounds like some sort of experiment or something. I can understand how that concerns people. But the process for which Moderna and Pfizer, especially, vaccines were derived, that research has been going on for decades. And scientists have published numerous studies with similar coronaviruses and their vaccines. All of the trials, the FDA-sponsored trials, were successfully completed prior to FDA authorization, even the emergency use authorization. The short answer is the bureaucracy was shortened. The COVID vaccine got moved all the way to the front of the list for all the approvals. That was the shortening process, but the safety and efficacy was not. This is an incredibly safe vaccine. All three of them are. Severe side effects alike. I'm going to get severe side effects from this. Severe side effects are rare. They're not common. We do see some mild side effects, which actually are quite similar to some you may have experienced with the flu. And that just indicates that your body's building immunity. Now, nobody wants to have this, have side effects, but that's telling you that the vaccine is working. Not everybody has side effects at all, and severe side effects are very rare. Again, work with your healthcare provider to see if you might have any contraindications. They'll quickly tell you if you do. Number 4, what? Okay, went wrong way, sorry. I'm too busy to get vaccinated. The appointments take a long time. Not here. I got to tell you, I am so proud of how our healthcare providers have made this process about as easy as anything I've ever seen. I mean, back when we were doing mass vaccinations, thousands of people a day, I have had numerous people stop me and said, it only took me 20 minutes. From the time I got out of my car to the time I got back in my car was 20 minutes. And that's what we have here. The actual getting your shot takes about 5 minutes. You'll sometimes be asked to sit in a chair just to make sure there aren't any issues with you for about 15, and you're on your way. It's a very quick process, a very simple process. And again, augustahealth.org/vaccine to get an appointment. Number 6, I'll let others get vaccinated first, and then I'll kind of see how everything works out. Well, it's certainly a personal choice, but experts say that anywhere from 70 to 85% of the population needs to achieve immunity, this herd immunity you've heard so much about, in order to help stop spread the disease through communities. There have been millions and millions of individuals who've received these vaccines. You don't need to wait any longer. It's time to get it now. The vaccine will mutate my genes, and I can understand how folks would be concerned about that. Even those of us who know what mRNA is. That's a pretty big deal. But mRNA and viral vaccines like Moderna and Pfizer never enter the nucleus of the cell. That's where the DNA lives, and it will not impact your genes. It's not going to alter your genes. It's a very safe vaccine. Number 8, I will get COVID-19 from the vaccine. The vaccine cannot give you the virus. It protects you from getting the virus. So again, a very safe vaccine. And this one, vaccines have a microchip that will track and control an individual. When I was looking at this, I thought this was a joke. Not a very funny joke, but I thought it was a joke. There are people out there who believe this. And what's further bizarre is they believe that Bill Gates was behind it. Folks, I can promise you, Bill Gates is not putting microchips in the vaccine so he can track movement and determine who's been vaccinated. Please help us put the myths aside. If you yourself aren't comfortable trying to help a family member or a friend get over the myths, refer them to an expert, they're a healthcare provider who can help them. This is not a myth. This particular pandemic is quickly becoming the pandemic of the unvaccinated. Even in our own health system, as the cases are going up, it is a rare occasion in which we see in the hospital a person with COVID-19 who has been vaccinated. Yes, there are some people who have been vaccinated that can still get COVID-19. And almost without exception, their illness is very, very mild. It's been referred to as like a regular cold. This is an incredibly safe vaccine. The people that are dying and are getting in the hospital right now are by and large unvaccinated. And if that doesn't give you enough proof to go get it yourself, I don't know what does. So what are you waiting for? Let's please help each other be comfortable with this. It's a personal decision. I respect that completely. We're going to respect it. But I can still strongly encourage, and I hope that you will as well. There is no question that things may change, and more importantly than that, I can promise you things are going to change. They're going to change probably as early as, I haven't even checked my email yet. It's probably had to change since I started this presentation. So I ask you to please keep in touch with what's going on here. Go to the AU website. Our folks are really, really dedicated to try to make sure that website is up to date on what's going on. Ask your colleagues what's going on. If you run into one of our healthcare providers, ask them what's going on. I'm going to start the weekly COVID updates like I did this past semester. I'll start either this coming Monday or the Monday after that. So every Monday, I'll shoot a video. It'll be out by Tuesday. Sometimes it's only just a few minutes to kind of let you know what the cases are and how we're doing, what's going on. Sometimes I have some other updates that may be important to you, new protocols that are coming around. The protocols that I just showed you are what's active at 4:30 on this date. They're going to change. There's no question about that. So we'll try to keep you informed on that. I do not have all the answers. And if anybody tells you they have all the answers, they are not telling you the truth. And that's just the way it is. It's not comfortable. I understand that. But my promise and pledge to you is that we will do every single thing we can to arm you with as much information as you need so you can carry out the work we do here to make sure that our number one priority, our students and our patients, are what we do day in and day out. We will continue to provide the outstanding education that we do here for our students and the state-of-the-art quality care we do for our patients. So I want to end on a high note because we have an awful lot to be thankful for, and we have a heck of a lot to look forward to. This next year, and this actually was a slide from my last town hall that was just back in June. What a world of difference that was. And what a world of things have changed in that short period of time. But these are the things that we're looking forward to and we're still going to be looking forward to. And this is the thing that I look forward to every morning when I wake up. First, we've opened the College of Science and Mathematics building. It is now open. The faculty are there, and we're ready for students to come in next week. That's open on the Health Sciences campus. It's going to cause a culture change here. There's no doubt about that. We're going to have a whole lot of undergraduate students going around. And I hope that you will join me in seeing that as one of the most amazing things that's happened here in a generation. That's what we're all about, folks, is education. And we have the chance to put these young people who have an interest in science and math, many of them want to go on to careers in medicine, dentistry, allied health, nursing, or biomedical research. And we plop them right down in the middle of the white coats. What a heck of an opportunity for us all to be mentors for those students. And it's going to cause a little challenges. I will agree with you there because we've got a lot more freshmen walking around going, what in the world am I doing here? Help them out. Make them feel welcome. It's a fantastic opportunity for us. In addition to that, we've got a strategic plan that we're just beginning to get underway here for the next 5 years about what this university looks like. The health system is starting off a strategic planning exercise to determine clinically where do we need to go in the next 5 years. And oh, by the way, we're in the early stages of planning to build a hospital in Columbia County, a 100-bed hospital for a county, the largest county in Georgia without one. What a great opportunity for us to be able to do that. We have a research infrastructure plan and design process going on right now. Our researchers have just done an unbelievable job. We have all-time highs in terms of research funding, and we got to make sure we continue that momentum, and a research building is in our future. We've got to start planning what that looks like now. We're going to be enhancing online delivery. Now, I just told you, we're all about in-classroom, in-person delivery, and that's certainly true. But we have an opportunity to really accelerate our enrollment opportunities by focusing on some online programs. And I am really excited about what this initiative is going to do for us. It's going to take what we all know and love here and allow us to put it on a world stage. And that's a pretty cool place to be right now. And speaking of enrollment, we're also going to be looking at a whole new way of assessing enrollment, addressing enrollment, and making sure that we get as many students here as we can, and also finding ways to keep students here for just 4 years and then get them out. So a lot of exciting things are going to be happening here. I can't wait to see what the fall semester is going to be like. I can't do it without you. We have a family here, And we have a family of dedicated folks, the likes of which I've never seen before. We will get through this, whatever comes our way, and we'll get through it together. So thank you all very much for being here. I appreciate your time. If you have any questions, go to the website. If you can't get answers there, find them. They're available. We'll do everything we can to keep you informed. Thanks so much for being here, and go Jags!